Recovery is the big differential between traditional sinus surgery and balloon sinuplasty. In traditional surgery, patients are usually very congested, sore, and have a lot of bleeding and crusting for 1 to 2 weeks. With balloon sinuplasty, usually a patient will have a mild headache for 1 to 2 days, very minimal bleeding, and not much congestion at all.
They're sent home with pain medication and with instructions. Most patients relax at home for a few days and they're in pretty good shape. And then they come in about a week or two later and we see how they're doing.
There are no scars and there's no change in one's outward appearance, which is great. Sometimes in traditional sinus surgery there can be bruising, but with this technique, since there's no cutting, there's really no bruising and minimal swelling. And the final result we tend to see in 2 to 3 weeks after that.
Usually we tell patients to lay off of heavy physical activity for a couple of days, 2 to 3 days, and then they can resume whatever they like. I've seen patients that literally go back to work the next day, and I've seen patients that'll take 3 days off and go back to work. But it's definitely not the kind of thing that's going to put you out of work for weeks.
What we hear most from patients is that they just feel so much better afterwards. A heavy cloud has been lifted, so to speak, from their sinuses. They no longer feel weighed down. They don't have that pressure, that pain. The cold that goes around the office is not turning into a sinus infection for them, and it keeps them out of the doctor's office.